The overall goal of this procedure is to assess neuromuscular function using percutaneous electrical nerve stimulation. This is accomplished by first connecting surface electrodes to the desired muscle. The second step is to install the subject on the ergometer. Next, the motor nerve is electrically stimulated using a handheld ball electrode or a self-adhesive electrode. The final step is to record electromyographic activity of the muscle. Ultimately, percutaneous electrical nerve stimulation is used to assess neuromuscular function at the supra-spinal, spinal, and peripheral level.
The main advantage of this technique is that it has a good reliability and the electrical and mechanical response are easy to obtain.
This method can help answer key questions in the field of neuromuscular physiology, such as evaluation of neuromuscular plasticity following training or rehabilitation program.
To begin, clean the skin where the electrodes will be placed by shaving off the hair and scrubbing the exposed skin with alcohol. This is required for a low-impedance connection. Next, ask the participant to stand tiptoe to clearly identify the plantar flexor muscles. Place two 10 mm silver chloride surface electrodes about 2 cm apart on the prominent bulge of the medial gastrocnemius muscle. For the lateral gastrocnemius, place 2 electrodes at 1/3 of the distance from the head of the fibula to the heel. For the soleus muscle, place 2 electrodes at 2/3 of the way between the medial condylus of the femur and the medial malleolus. For the tibialis anterior muscle, ask the participant to stand tiptoe to identify it. Then place 2 electrodes at 1/3 of the